and I found mold and all these symptoms, and then it's always like 6 months later, it's like, oh my God, hey, how are you? Yeah, it turns out we had a gigantic mold thing in our basement. We had no idea that it was there.
You're listening to a Bio Reset Medical Podcast with Dr. Cook. If you have questions or want to talk more about your symptoms and issues, you can always reach us at 650-888-7950. The following is a Q&A hosted by Dr. Cook, where he hosts weekly calls with doctors.
So I've got a couple, I've got some case studies here to go over, which I think might be kind of interesting. So here's one from Dr. Webb. Can we discuss treatments for MS patients and therapies for healing the blood-brain barrier? That's a good one. These just get handed to me like 10 seconds before I sit down, so I haven't thought about this. But I've taken care of a lot of people with MS, which is interesting. And a couple things. One, ozone's surprisingly helpful for MS. I actually read that there was an MS model that they had in animals, and in that model, there were animals, and there was felt to be an infectious component to it, and they had an animal model for MS, and in that animal model, they had I got to look and figure out where this. I haven't read this in years, but in that model, they took stool and then did a stool transplant from mice with the illness into mice without, and then the mice developed the illness. And the idea is that that there may be an infectious disease component to MS. And it was interesting because I have a patient who I saw years ago, and she came in, and so she didn't want to do an IV, and so I did. I said, well, we could do rectal ozone, and so we had that, and I showed her how to do that, and then she was like, oh, my MS symptoms are like 50% better, like right on the spot. And it was kind of like one of the. It taught me at a very early moment what a profound and interesting thing ozone is, and that was rectal ozone. Now, the interesting thing about that is that I've been concerned, and I'm still sort of concerned to some extent about doing rectal ozone because it's affecting the microbiome of the colon. And so that could be good if it was extremely dysbiotic, but that also could be bad because you're affecting the balance of good and bad. And so what I always say is if you're going to do rectal ozone, it's super important to do a lot of probiotics and make sure that you're anything that you're killing, you're replacing and resetting. And in terms of a dose of ozone, obviously the IVs work great. And then you can make ozone water and drink that. And the small intestine is supposed to be sterile. So as a way to get ozone in, if you make ozone water and that comes in, the ozone water is in the small intestine, and that's supposed to be sterile. Obviously, people can have SIBO, and so there's bacteria in there, or SIFO, which is fungal growth, and often it's some constellation and combination in there. And so, but in her case, that was fairly transformative. Now, interestingly, the first step on neurocognitive, neurodegenerative, Lyme, everything else is to, in broad terms, get a sense of what's happening. And so then I think, and so then that would be my case for MS. So number one is mold an issue. And so I do a urine mycotoxin. If that was positive, then for sure I would do a Marcons, because often a biofilm in the nose is the cause for mold. alternatively, if so I would ask them if they have any symptoms and if they have nasal symptoms, and they had a high amount of urine mycotoxins, then I would definitely do this nasal swab. And that nasal swab is for Marcons, which is multiple antibiotic resistant coag negative uh, and strep. And so then we'll do that, and then we will then if I find that to be positive, then we do the different protocols of treating that biofilm to make that go away. So nebulized glutathione, nebulized hypertonic minerals is kind of good and super cheap and easy, and nothing bad happens when you do that. Then there's a bunch of antimicrobial sprays. The most common one that people will do for that is Beg's spray. And then there's also people who will make colloidal silver sprays. And we will certainly do those and have had good experiences with those. The other thing I'll look for is gastrointestinal infections. And so we'll do stool testing. I'll try to get a sense, is there SIBO or SIFO? And then try to get a sense of if there's a lot going on and if there are biofilms, and develop and design a functional medicine approach to treating the gut. And so then those first two things are super important. If I think that there's mold, I'll do we have a mold antibody test that we use, which is fantastic. And Dr. Campbell, if you email Kristen, I'm going to email her I've got a couple of good PDFs on mold that he uses that are kind of nice to have, and you can run through those with patients. And he's a great thought leader. And when I see high levels of mold mycotoxins in the urine, and then when I see high levels of mold antibodies in the blood, that gives me a sense that obviously this is a big problem, and this has been driving an immunologic response, which is dysregulating the body because it's supposed to be focusing on whatever it's supposed to be focusing on. And if you look at the levels of mycotoxins in the urine, a lot of times you'll see if the high end of the normal range is 10 or the high end of the normal range is 150. With people with neurocognitive and neurodegenerative problems, it is not at all surprising to see a level that's 10 times above the normal range. And so then you go, well, that's crazy. What's going on with that? And I think that when we always talk about Lyme disease, but then as we were talking last week, we were talking about all the co-infections that are related to Lyme. I think that when you start to talk about anything in the neurocognitive, neurodegenerative, I think that the first thing you have to do is rule out mold, because we've seen so many times where the mold levels are unbelievably high. And so I think of mold as kind of like a co-infection or a driver of neurologic inflammatory problems. And I think a lot of times that comes from the nose. A lot of times that's in a water damaged building. A lot of times there's mold in someone's house. Front loading washer machines are mold factories. And I've had in my own, like when I lived in an apartment, I had multiple times where you looked and then you opened the little door on the front loader, and there's a little rubber thing there, and if you look behind it, there's always mold in there. And so then whenever I have people like this, then I have them do ERMI testing, or if I can, I get them to have somebody come out to their house and figure out what's going on and see if there's mold. I've had, I don't know, like 40 or people that were like high net worth, unbelievably beautiful houses. and I found mold and all these symptoms. And then it's always like 6 months later, it's like, oh my God, hey, how are you? Yeah, it turns out we had a gigantic mold thing in our basement and we had no idea that it was there. So it's just super common. And it's like, you just have to check every box off. And then if email Barb or email Kristen on this. I feel like I'm gonna want to give you a money back guarantee on what I'm gonna say next because it's so amazing. My friend Zooey Boo was this anesthesiology resident with me, and we were and he would always give people a money back guarantee. So it's kind of funny, but there's a machine. It costs $360, and what it is you run cold water through this little ozone machine before it goes into your washer and dryer. And so you don't have to use soap, and then you don't have to use any detergent or anything. And the ozone levels are really high, and your clothes smell totally perfect with no smell. And it's like an amazing anti-mold thing. And so then I got one of these for my house, and it's like it's honestly one of the greatest things I've ever found. And so then whenever and so I have like a piece of paper with the name of it, and like literally people sit, and then during my consult they'll like order them. If you have a front loader, then I would just get rid of it and get a top loader. It's like literally that important. And so then I always have people on the MS side go through that whole workup and figure all of that stuff out because I think it's super important. I take a history for tick bites and all of that stuff and tick-borne illnesses, and because I think that there's a significant concordance of Lyme disease and MS, as well as some of the other cognitive and neurodegenerative problems. And so definitely try to rule those out. I think that there's a gut-brain thyroid axis that, and they're always talking about an A4M and trying to reinforce with cases. And my thought is that as you're talking through how people are doing, I think a lot of times brain fog and a lot of the neurological symptoms actually relate to leaky gut, that is SIBO and SIFO. And so then beginning to address that is, I think, a game changer for so many people. I've got a bunch of ideas. That's probably like a full, that would be like a good kind of a hour-long talk to kind of go through that whole piece. If you want to do that in the next little bit. I think that as soon as you start to go down the Lyme neurologic fatigue, then there's this concept of chronic viral. And so sometimes I think one way of thinking of chronic fatigue is chronic viral. Another, sometimes that's chronic Lyme. When we do our Lyme workup, we'll do a blood test where we'll look for viral titers. And almost everybody that is in the chronic Lyme and sick category, a high percentage of them will have high mycotoxin and will have a mold component, but a high percentage will have EBV, CMV, human herpes 6, and a constellation of other sort of viral high titers. Fortunately, we've in a fair bit of depth talked about everything good that we can do on that front over the last few months, and so then I think that's good. I think IV ozone is the best thing for that. I had a great case yesterday of uh, a a kid. I call someone who's in their 20s a kid who I super like, and um, was is Lyme and chronic illness, and it's been difficult case, but it's kind of moving in the right direction. And then it was uh, developed cervical lymphadenopathy and a super sore throat, and came in. And it was interesting because she was going to go to the urgent care, but she wanted to come to us instead. And this is this is kind of like part of who we are. I think it's just kind of interesting. And so then my friend Mike Stone is a super smart ER doctor. So then I just called him. If I was going to call you, Jan, if he didn't pick up. So, but so anyways, we talked it through. Turns out the symptoms have been coming on for a month, and the there was a bilateral tonsillar exudate. There was no shift of the uvula. She could open her mouth really well, and you could see in. And he felt that based on the fact that she could open her mouth well, that it was a slow indolent course that came over more than a month, and that she basically was like very mildly afebrile, but not hot. He said it's almost for sure viral. It's probably not bacterial. He goes, you could treat her, but I think it's probably a viral pharyngitis. And so then I gave her IV Ozone, and then immediately she was like 30 or 40% better. And then we did it again today, and she was better again. And so we're going to treat her again. And it was fairly profound for me to see her, the extent to which she third spaced. So like on day one, it was like her entire face was, it was like there was a liter of fluid in there. And it was significantly better, almost like a different person, just after one treatment. It was pretty interesting. So it's kind of exciting to be able to be helpful for these cases. And that is in the genre of something that I feel like I've done like 2,000 or 3,000 times, of someone coming in with some version of a difficult viral situation that you that responds extremely well to ozone. And so then to go back to the question, in these big problems, I think we have to really search as hard as we can to figure out, is there a viral component? What are all of the antecedents that led up to this? And then I think once you begin to do that, people do like 10 times better, because you're getting the different systems that are all interacting with each other in the body to be working better together. And so if you're positioning yourself like me and Marcella as neurologists, that's kind of interesting. We're positioning ourselves as, neurologically oriented anyways. I think it only makes sense that you have to be a gastroenterologist too, because that's driving so many neurological processes. What do you do to, so then it tied into that question was, well, what do you do to heal the blood-brain barrier? And so I don't know if you guys have ever seen this. It's kind of a home run experience to me in terms of communicating a concept. And the Bermans, Sean Berman, and his dad from Cell Surgical Network, and they're great people, and I'm totally supportive of their technology and their concepts, and they're stromal vascular fraction adipose stem cell people. But obviously that field has taken a little bit of a hit just because of the FDA. And interestingly, that's where I came from. I basically spent a year with Bob Alexander doing adipose cases. And so that was my whole world. And I created myself to do that. And then I'm kind of in the middle of a pivot, a 10-year pivot. But what they did is they took, they had an animal model. And so they took mice and then they applied a shock device to it and created a traumatic brain injury. And then what they did is they took and divided it into two groups. And then one group received no treatment. And then the other group received stromal vascular fraction stem cell treatment that was put into intravenously into the tail vein of the mouse. And I don't know if they'll let me get a copy of it may be published. It was preprint. Well, we'll look for that. We'll find out if that is there. But basically what you see is all the brains that were not treated, you see these little red hematomas right where they applied the shockwave. And all of the mice that got treated with stem cells, none of them had any hematomas except for one, but it was like way less than the other ones. And then they measured their ability to roll over and do all the things that mice do when they're running through cages and responding to triggers. And they all basically performed significantly better than the people, the mice who were not treated. And so that was their conversation around regenerative medicine to treat traumatic brain injury. And so, that they did this trial 5 years ago, and I think that it was very important from a basic science and from communicating to you this kind of idea of looking at the hematoma. It's like that is like indelibly burned into my brain at that moment. Now, then you say, well, what do you do to heal the blood-brain barrier? So then before I go to regenerative medicine, then I want to back all the way up, because I think philosophically what we want to do is think about the cheapest, easiest, simplest, safest, lowest risk things that we can do. And then in particular, when you think about who's getting traumatic brain injuries, it's a lot of kids. You know, I don't want to take a 14-year-old kid and do an adipose harvest to do a stromal vascular fraction stem cell treatment for their concussion. And that being said, I still totally love the idea. I think that NAD is going to be probably one of the best things that you can do to heal blood-brain barrier problems. And the reason I feel that way is that I've got thousands and thousands of examples of people who came in and start to do NAD IVs, and then their veins get better. You see people come in and they had like one IV, and then next thing you know, they've got one vein. And I had one hand vein, and I would start treating him. And a lot of this came from my experience in the addiction world, where I would have heroin addicts that had like one tiny vein. And then you start treating them, and then they start to get better. And then once they start to get better, and then the NAD, imagine that this is a cross-section of a blood vessel. So the NAD is in the middle of the blood vessel, and now it's got to dissolve out and get into the tissue. And so then that means a lot of that NAD, the area of the body that's going to get the most NAD is actually the endothelial cells, because those endothelial cells that are living right there facing that blood vessel. And generally, my experience is when people start to do NAD IVs, sometimes headaches get better. Sometimes a lot of neurovascular symptoms will start to get better. Sometimes cardiovascular things will get better. And so I'm quite intrigued by the possibility. The other interesting thing is, in terms of traumatic brain injury, there may be, when you look at the long-term complications of why people struggle with traumatic brain injury, part of that may be the classic excitotoxicity conversation that we all learned in medical school. But there may be, and I found several articles talking about this, talking about an alternate non-excitotoxicity mechanism of chronic neurological damage that's mediated by dysfunction in some of the NAD pathways. And interestingly, I've treated a lot of people with TBI and concussion with NAD, and then you'll treat them, and then I've seen them just be like, "Oh, I'm back." It's like, "Oh, I'm back," and I don't know if that's because part of their brain was stunned and was maybe electrically not working, or if the endothelial function started to get a little bit better, and as a result of that, they were allowed to heal. And the reason I told the story is it was profound to me to see that brain tissue with the hematoma on it versus the brain tissue that was treated and didn't have a hematoma. So the more that we can do to turn inflammation down, we can heal that. Now, in that trial, what they did is they gave them the concussion, and then they treated them like within like an hour or something like that, as opposed to what typically happens with us is somebody gets beat in the head playing football, and then we don't see them for like a month until the fact that they just didn't recover and now they're struggling at school. So so know that we probably need to see people sooner, could do some simple things. Interestingly, it's a lot to do an IV, and it's a lot to do an IV for a young person. But I think that there's an enormous amount that we can do at lower price points to help people with subcutaneous NAD. And the Archway formulation for the subcutaneous NAD is amazing. And so I think that that's a good blood-brain barrier support. I think that if this is a crazy year in terms of everything that's going on, and it just seems to get crazier. But then obviously, hopefully the regulatory agencies are going to be weighing in on a lot of what we're talking about from a regenerative medicine perspective. I think that there's a good experience of people who've gotten exosomes IV and had an improvement in symptoms. And so what I think we need to do is probably do some trials where you begin to do similar things either in patients or in an animal model where you give exosomes intravenously and then see if that helps duplicate something kind of like what Sean did, and see if that helps. I think that makes a lot of sense. The issue is we're in this moment of unfounded or unproven therapies, and so I think we have to be very careful about how we talk about that. I think we have to be very, very careful in not promoting that, and that's why I think NAD is a great alternative. Obviously, I think there's a whole bunch of functional medicine lifestyle things that I think are all good along those lines.
BioReset Medical is a medical practice specializing in integrative therapies and advanced wellness protocols. At BioReset Medical, we treat some of the most challenging to diagnose and difficult to live with ailments that people suffer from today, including Lyme disease, chronic pain, PTSD, and mycotoxin illness. Our team has a wealth of experience in advanced integrative strategies to get you to optimum wellness, many of which can be conducted remotely from the comfort of your own home right now. Our team's approach is to use the most non-invasive, natural, and integrative ways possible. Find out how we can help you by reaching out to us at 650-888-7950 or at our website, www.bioresetmedical.com. It's going to be amazing.
Do you have any questions about anything I said up until now?
So my question is, how do you dose the sub-Q NAD?
Oh, how do you dose it? That's a good one. So the two people, one person has no problems, everything's great in their life, and they're kicking ass. That person on day one, I give them a 5 cc vial. And so on that person on day one, and then I say, are you sensitive or kind of resistant to stuff? And if they say I'm sensitive, I might give them a 1/4 of a cc, or I might give them a 1/2 of a cc. 1 cc of that product, the subcutaneous, is 200 milligrams. So 1/2 a cc is 100 milligrams, and then a 1/4 of a cc would be 50 milligrams.
Yeah.
Now, if they were real, let's say if you talked to me and you said, hey, I want to try NAD, and I said, are you sensitive, Hyla? And if you said yes, then I would say, oh, okay, just do a 1/4 of a cc tomorrow. And if you don't really feel anything, do a 1/2 of a cc the next day. Mm-hmm. But then I think you're probably going to like to do maybe 1 cc.
Yeah.
And 1 cc is 200 milligrams. And that's been kind of the standard dose is between 1/2 a cc and 1 cc. So i.e. between 100 and 200 milligrams. Now, the issue is when you do an IV of NAD, the NAD causes flushing. And so then what happens is, as a result, what I can do is I can slow down the IV, and the slower the IV goes, the less the flushing is. The issue when you do the subcutaneous injection is you're committed to however much flushing is going to happen because it's just getting absorbed. Now, if someone's sensitive to flushing, I always have them do like a bunch of TMG, like maybe half hour before. And then in the high dose range, like what happened is for some reason we ordered a lot of sub-Q NAD, but then like the COVID happened. And so then we ended up with like a whole bunch that was expiring. And so then like I haven't been doing any sub-Q NAD, but then we had a bunch. So I've been doing like, I did 2 cc's the last couple days just because I was like using it up. And so interestingly, now I don't really feel anything with 2 cc's. And I don't do TMG, but then if they're walking around, they hand me TMG if I in the hallway or something like that. So I have almost no symptoms with that. And it's kind of interesting. Now, what's super, super interesting is there's a cohort of people, and then I'm going to dive into this and figure this out. But I haven't yet. There's a cohort of people who you can do NAD, but if you give them sub-Q NAD, they will flare like crazy. I think that's because they've stored toxins in their fat. And so I think some people's fat can be a little bit more toxic. And I think that I was one of those people because when I first heard about sub-Q NAD, I was like, yes. And then I injected it and it killed. And then I had pain the whole day. It's really interesting. And it was like that, like the first 15 times I did it. But then after that, it doesn't hurt at all anywhere, ever when I do it. So what that teaches you is that some people hurt. I think it relates to if their fat is toxic. Interestingly, little data point about me. is that I make lipomas. And there are some people that make lipomas and some people that don't. And that so I do that. And I think that, and interestingly, ever since I started doing this, I've all my lipomas stopped growing, and then half of them have gone away, but some of them have not gone away. So I'm like kind of interested in that. I think that's an interesting one. Now, this is on the healthy side of the conversation. Now, the other, in terms of dosing NAD sub-Q, the other side of the conversation is people with big issues like Lyme and mold. And a significant percentage of people with Lyme and mold, if you give them 100 milligrams of sub-Q or IV NAD, it will super flare them. And if they're really, really sick, if they can kind of barely make it in and you realize that their whole world's falling apart, definitely don't give them NAD at all to get going. And I taught, I don't know if I told you guys this, I taught essentially all the Bay Area Lyme doctors how to do NAD. And remember, in the addiction world, everybody's doing super high doses. And then Eric Gordon told me he gave NAD to a handful of pretty sick people where he gave them 200 milligrams and it flared them for like a week. And so that's because NAD drives detox reactions. And if your detox pathways are not open and not working, if you drive that, it's like I was telling somebody today, if you got a hotel and you got the garbage out of every single room, but then you didn't have a way to get it from the hallway out, the whole hotel's going to seem like a mess. And that's kind of how I think of these detox reactions if you haven't got them turned on. And so then your dosing range could be somewhere between 50 and 200 milligrams, or like I did 400 milligrams today, but I hadn't been doing it for quite a while. If I had somebody who was sick who wanted to do it, or somebody who was fragile, I would be in that 25 to 50 milligrams, and then do it as a test dose, and maybe even do that for a day or two and prove that they could do that, and then do more. Is that helpful?
Yep. Yeah, the stuff I have is a little expired.
Well, I definitely would not give that to anyone.
Don't give it to anyone, just me.
Well, yeah, I think it'd be fine for you to give it to yourself as long as it's not that expired. But I would then if that's the case, I would still go super low dose.
So does it just lose its potency, or does it get like something bad about it?
The one thing I can tell you, Archway's NAD is amazing. As far as I can tell, they have the best NAD. There are some other companies that have NAD that has a lot of phosphates in it. And the phosphates are somehow detrimental, and I don't know what it is about that. I'm going to call those guys and talk to them about it. But I've had 50 people who were like just kind of friends and VIPs who were flying around all the time, and they're like, "Oh yeah, dude, I got NAD and it made me sick for 3 days when I was in New York." Like a bunch of guys went to New York and got NAD, and and then they told me what they paid. I was like, "Yeah, that's like you paid less than the cost of the product." And so then I know that there's a bunch of sketchy product out there. And so then that just is what it is.
Yeah, mine was from South Africa.
Yeah, I don't know anything. I don't have anything good or bad to say about that.
Okay. Fair enough. Thank you.
Yeah. Anything else? This was kind of an easy one. I'm trying to think on MS. So then I've had, so MS patients, I've done culture expanded stem cells in Mexico for patients with MS. Very good experiences. I've done exosomes out of the country, let's say, for MS. Very good experiences. I've done the full set of functional medicine and all that stuff. Very good experience. I've never had anyone come in with MS that I didn't find like 6 major things on functional medicine. And so then that kind of makes sense when you think about these things, because that's like this inflammatory neurological condition. When you're doing all that stuff, there's a Cyrex panel that's kind of good that I think is interesting, that will look at brain autoimmunity. And I generally always try to do that whenever I'm doing any neuro cases, and will uh, and then they tend to correlate that if there's any gluten cross reactivity, and so that if you go to joincyrex.com and look at array 7x and 20, those are interesting. I think I think that ozone's going to be a big player, and I think ozone dialysis is going to be kind of an interesting player on the MS side. I really do. Oh, and then for MS, then the next thing is to go back to that. I would obviously do everything on the blood-brain barrier front, but then I think it's going to be I think it's useful and important, and I've really been doing as much as I can to talk about regenerative medicine last, because it's just I'm kind of like, well, I want to do everything that I don't want to leave any stone unturned, and then I want to do all of the lower cost, amazing, good things that we can do. And I think peptides is going to be really interesting. And the interesting thing to consider is, does it seem like there's an infectious program, or does it seem like there's not? And so then I think that's interesting to be able to kind of work your way through, because if there's an infectious component to it, then that's going to drive me down the thymosin alpha pathway, and at least starting that. And then I have not recently looked at C-LANC and C-MAX in terms of what has been done with those and MS. Obviously, there's the entire world of cerebrolysin, which I'm working on some avenues to bring that to market a little bit. And so I think that's intriguing, and I'm going to talk to a couple people, and then I'm going to have an answer for you on that hopefully next time I talk to you. But so then the whole peptide conversation is super interesting as an adjunct to all of this stuff. And I think that the combination of functional medicine and peptides and regenerative medicine is a good combination, and a good approach to the neurodegenerative, neurocognitive, bundled in with some version of ozone and ozone therapy. I did a consult with somebody on the other side of the country today, and then he quoted he literally, it was amazing. He quoted these a bunch of stuff from Schallenberger, which was sweet, because I just have to tell you, Frank is great, and it was I loved that this guy he had an entire paragraph, and he read me this paragraph, and I was like, if I could, I would literally read you that paragraph until you do it. And so we had a good time with it. But Frank, and what this patient had found for me was this statement that Frank made, which is that you oughta start with low dose therapy and do it twice a week, and then work your way up, and then slowly do more. And fundamentally, what I do is some version of that, because I'm doing but instead of doing major autohemotherapy the traditional Schallenberger way, I'm doing it with the a more modern machine, but we're doing one pass and then 2 or 3 passes and then slowly working our way up. But the idea of small, early, low dose therapy that you can build on, I think is a good idea. Frank's had a good experience taking care, using ozone and some of those modalities in patients with concussions. If I had somebody that I thought had blood-brain barrier problems and I did ozone, I probably would give them vitamin C on the same day. So I didn't do something oxidative and leave them in that oxidative state. Because we were talking about the oxidative state and the antioxidative state. And it was it's kind of interesting because, last week we were talking about ozone dialysis and we were talking about the yin yang. And so ozone is oxidative. It's kills things. It's just like masculine. So obviously, so I apologize on behalf of men. And then yin is feminine and receiving and healing and so then vitamin C would be yin, ozone would be yang. And so then sometimes when one school of thought is do a 10 pass or do ozone and then let them continue to have an oxidative experience for 24 hours and then the next day do yin. And so I have this person who's here this week who's super great, who I just am kind of helping and in his life. And it was amazing because I met them at a party and it just seemed like catastrophically bad problem. And then I said, well, I probably can help you. And so you should just come see me and then it'll be great. And then I waited for like 18 or 19 months. And then he showed up in my clinic one day. And it was like, it was like 15 years of like 10 out of 10 pain. It was kind of crazy. And so then I basically kind of taken that as like one of my pro bono cases. And it's just been totally the highlight of my life. And it's kind of interesting because it was like stressful to decide what to inject because there was like 15 things. And so then it was so great because I did a lot of hydrodissection with peptides and a lot of hydrodissection with placental matrix. And it all started from a groin injury, interestingly. And so then the anatomy there is kind of interesting because I hydrodissected obturator nerve, femoral nerve, sciatic nerve. I did everything. So it's kind of great because he came and he doesn't have any pain anymore. It's like really interesting. He's like, I don't know, I think something's in my ankle. But it was amazing because it was like 10 out of 10 pain for like his whole life and he was on disability. And then so then he came and we were working on fatigue. So we did ozone dialysis and we did that. And then it's just like amazing, to see somebody like just living their life, walking around normal, And so then we did a lot of, like, you deserve to be here and you deserve to have an amazing life. And it was kind of like what I do with ketamine. And I just totally like loved it. I loved every second of it. And then I did this thing that I'm doing now that I'm going to tell you about, which is, I think, kind of the greatest. It's the greatest thing that I've ever done, I think. Kind of. As I'm almost getting choked up thinking about it. But anyways, I said, we're going to do this thing where we do ketamine. But I've been doing ketamine assisted therapy. So I do it as a therapy rather than as the traditional journey way. And so then what we did was I run it at a real low level. So it'd be like if you were altered on a scale from 1 to 10, you're altered like a 2 or a 3 or a 4, but like not that altered. So we're talking and having both a back and forth and normal conversation that's kind of like this. And so then I was like, what do you think about this? And then just kind of like talking. And then what happens is we work our way through the big themes of your life. And then there's certain things that are like a big theme. You're like, that's not true for me at all, but I kind of wish it was. And then what happens is, and we all have that. Like I could say whatever. Oh yeah, like I kind of wish I could do that, but I can't do that. Like whatever that is. So then what'll happen is I'll sit there, and I did this my whole life as an anesthesiologist, and it kind of hit me. It just hit me out of the blue. And so what I would do when I was an anesthesiologist is that I would do nerve blocks and then have someone sedated, and then kind of like I knew how long it would take, and then I would turn up at the anesthesia and the ketamine right when they did their thing, and then I'd turn it off, and then it would be like they didn't get quite so much anesthesia, and it just like nothing happened. So that was kind of how I made my career as an anesthesiologist. So then we found all the stuff that was true for other people, but not true for our experience. So then what I do is I sit there and then I turn the ketamine up, and I go up to like an 8 out of 10 of intensity. And so then I'm like, and then I do that. I've been doing this thing a lot where I'll do it back and forth. So I'll go, let's say, so do you want to do this with me, Marcella? That's a good one.
Go for it.
So then what I do is I'll go, I deserve to be here. So now you repeat it.
I deserve to be here.
I deserve to be here.
I deserve to be here.
Awesome. And so then what happens is we'll just kind of talk, and we'll talk almost just like this, just like if you were, you saw me do kind of stuff like this. But it's the greatest thing ever, because all of a sudden, like you were talking to them 20 minutes ago and they were like, I don't deserve to be here. And then all of a sudden you'll get to this moment, and then all of a sudden it's like, I deserve to be here. And then what happens is I came in today, and yesterday was the yang day because we did the ozone. And so then he spent the whole day writing, because today was his yin day. And so he was looking at everything from a yin perspective, and everything yesterday was yang. And so then and so then what happens is when you can get to that, I deserve to be here. Now try this one. We deserve to be here.
We deserve to be here.
We totally deserve to be here.
Totally deserve to be here.
And so then what I'll do is I'll play, like, I'll try to figure out what your favorite song is too, if I can, and then I'll play your favorite song, and then we'll be like, we deserve to be here. And so then what happens is everybody 100% remembers that, because it's like not, ketamine is not has no amnestic. So you remember everything. And so then what happens is you remember this time where in your entire being, with your whole energy and your whole consciousness, you realize, we deserve to be here. And where I go, I never have any idea at all. Which kind of, Arkady, who's my yoga teacher, who was kind of like this, who was like, you just have to find out where you're supposed to go. It's interesting. He was like antithetical to ever having a plan on anything, which is interesting. But obviously we need to have plans. But within this, then what happens is, what I think is happening is then you get to continually reference back to that moment when you realize that we all deserve to be here. And so then in doing that, it's like the next day. And then what I've noticed is I'll talk to people like, hey, do you remember that? Like, they're like, oh yeah, I think about that like 25 times every day. And so then I'm kind of like, oh, I do think that that's just like kind of the greatest thing ever. Because then all of a sudden we all deserve to be here. And then and there's been this interesting, to talk about MS, to talk about Lyme, to talk about all this stuff, and this was like all the cases that I had the last couple of days, are all somewhat catastrophically overwhelmed with fight or flight and stress. And then I'm noticing like a lot of people, it's interesting, I had a friend come in, kind of melt down. And so then I just said, oh, come in and do ketamine. And I did it for him. I did the same thing, and it totally worked great. And then he kind of like, he came to the realization is like, it was some version of the same thing, that like, oh, I deserve to be here. And that like, and he told me, he said, I felt like there was a hypothetical that I was going to get through COVID, but I didn't. It was hypothetical, and I was really afraid 24 hours a day. And then he said afterwards, he goes, I just feel like I have a shield and I'm walking around and I'm going to be okay, which is this is kind of interesting. And I think that to tie this back into neurocognitive, neurodegenerative, and all of that stuff, if COVID was a 5 out of 10 stress in your life, if you added MS to that, I think it would go to 15, And so you begin to realize everybody with big problems has fairly profoundly overwhelming issues with depression and anxiety and stuff like that. And a lot of it is just a sense that they may not be okay, or there may be no solution. The great thing is that so much of what we do involves the possibility of taking some control, and so you're taking control of food and diet and lifestyle and supplements and strategies and opportunities. So, but I'm kind of just endlessly fascinated with kind of the PTSD, anxiety, stress kind of space, because I think we have this wonderful possibility to kind of reach out and help people. And so if you want me to talk more about that, I'm happy to. But I almost feel like what I want to do is like do a video of it or something, because it's just the most, and then being part of it is the most magical thing that I've basically ever done, because what it'd be like we deserve to be here, like what we did. What happens is, if you didn't deserve to be here for some reason, Marcella, it would be hard for, I doubt that I could totally get you with every bone in your body to believe it in like 30 minutes. Like that might be like, oh, let's talk to Marcella for once a week for a couple months, and maybe she'll kind of get her thing, right? But yet my experience is people kind of get there fully, totally, and completely in one little fell swoop of 30 minutes. And then that sort of changes everything going forward. I kind of feel like you could do it without that. Now I kind of feel like I think that if I have a good enough music system and some lights and like a whole bunch of nice people kind of doing something, I think we could just do it without. And that's kind of my idea. But I do think that it's super synergistic. And then also ketamine is super, remember that ketamine is super facilitated by NAD and all that type of stuff. All right. Hey, shout out to Laura. Nice to see you. I owe you a phone call. I'm going to do that. Thank you for texting me, though. And then I know I'm sick. I can't believe that happened to you. But I love you, and I'm thinking of you, and I'm going to call you. Nice to see you guys.
Thank you, Matt.
Questions? Okay. I hope, was that helpful?
Yeah.
Yep.
Okay. It's going to be amazing. Here's the thing. It's going to be amazing, and we're going to get through this. Oh, do you want to know you know what I've been telling everybody about the last couple of days? Volatility is the greatest thing ever. Volatility is the greatest thing ever. It's the best. So
It's in the eye of the beholder.
You say, yeah, exactly. You know, it's like did I tell you the thing about smart money never loses?
No.
Somebody told me this. I loved it because they were talking about politics and crazy things happening. And the guy just smiled at me. He goes, smart money never loses, dude. It's going to be fine. He goes, something bad's going to happen. That's great opportunity on the other side of the bad thing happening.
Don't let a good crisis go to waste.
Exactly.
A famous person said that. I don't remember who, but
yeah, find that out. And so then even the social things that are going on now represent that the disrest is here because there was dysfunction. It's just like the same as the gut. There are large systemic issues that are creating inflammation in aspects of our society that we just haven't addressed. And so then there's an enormous opportunity to address that and do good. I have this idea that I want to do of take a whole bunch of people that had the worst thing that ever happened to them in their life and then do that thing of I deserve to be here together. So then I got a good idea. Everybody unmute yourself. Okay, so then let's all say this. We deserve to be here.
We deserve to be here.
We deserve to be here.
We deserve
to be here.
We're going to be way better after this.
We're going to be way better at it.
Right after this.
It's going to be totally amazing.
we're totally amazing.
It's going to be totally amazing. We're going to help people. It's going to be amazing. All right. Well, awesome. I love you guys. Thank you for being here. It's going to be amazing.
Thank you.
Hey, Dr. Cook,
Thank you so much.
Oh, you're welcome.
can I ask you a question, Dr. Cook?
Sure.
How do you test the blood-brain barrier? Do you use Vibrant America or Cyrex or a different lab?
So Cyrex has a panel. If you go to joincyrex.com, you can look at their panel. And they've got two panels. I'm not looking at it right now, but I think it's 7X and 20. And those are a measure of brain autoimmunity. And so then that's a test. I don't think that there's a perfect test for quote unquote leaky blood-brain barrier. But I think there's another thing is that I think that there's probably a concordance with people who have leaky gut with leaky brain. And then those antibody tests are an attempt to look at that. Now, another thing that you can do is look, Cyrex has some panels that look at and assess for a leaky gastrointestinal barrier. And you can, I think this is 2, 3, and 4, look at those panels. And so then that's going to be useful potentially for you.
Okay, great.
Okay.
Thank you so much.
Okay, thanks guys. Have an awesome evening.
You too.
Good night, you too.
You can find this Bio Reset podcast and others on iTunes, Spotify, and all other top podcast directories, as well as on bioresetpodcast.com. Make sure to subscribe, and thanks for listening.